Systemic response to exercise. So before we begin, I'm gonna say there's gonna be a few spoilers ahead. If you're any Resident Evil fandoms, do note that there will be spoilers. So let's go. First parameter is oxygen consumption, represented by VO2. So oxygen consumption, as the name of it suggests, is basically the rate at which we consume oxygen during exercise or during any physical activity that requires oxygen. The intensity of an exercise would increase the amount of oxygen that we consume because our muscles need more oxygen to produce more energy. So here we have a graph that describes the relationship between workload, aka the intensity of an exercise, and oxygen consumption on the y-axis. So during the first 3 to 6 minutes of exercise, it would first increase, like so, here. But once it reaches the steady state limit, it would plateau, indicating that that is basically the point at which it is unable to further increase here. So an increase in exercise intensity would induce an increase in oxygen consumption, because of the skeletal muscles and the metabolism that is required to continuously contract them during the exercise. So let's go to the parameters of oxygen consumptions. We have, actually, we only have oxygen, the maximum oxygen consumption, or VO2 maximum. So if this is increased, the body has a greater working capacity for consuming oxygen and is able to endure higher intensities of exercise. This basically means that if you have a higher capability to consume oxygen at the highest state, like you can consume more oxygen, that would mean you would be able to supply your muscles and maintain that momentum, that those contractions, that physical activity at a higher intensity, right? So here are some parameters that can impact the oxygen consumption maximum. So for age, it has an indirect relationship. The older we get, the decrease in our maximum capacity to consume oxygen. However, the younger we get, the higher. That's why infants usually have a higher maximum for oxygen capacity. Next, we have gender. Usually, males have more of a capacity to consume oxygen compared to females because of their anatomical composition. They have larger structures, larger lungs, larger heart. And for physical activity, athletes, compared to untrained individuals, have a higher maximum for oxygen consumption because they are continually training and they are continually doing exercise that would help increase their rate of consuming oxygen. So to sum it all up for oxygen consumption, if exercise intensity is increased, oxygen consumption will be increased. It's very straightforward. Moving on, we go to heart rate. The heart is a very important organ, and without it, if it doesn't pump, then there's no blood flow. And if there's no blood flow, then you will die. So it's very important that you have a heart. We have a few parameters for heart rate. First, heart rate rest or heart rate at rest. So this just refers to your rate of heartbeats when you're not doing any physical activity, you're just sitting down or you're just relaxing. This has an indirect relationship with age due to the decrease in the heart's inefficiency. So for example, we have Leon Kennedy here. He's already 51. So his heart rate at 51 is very different from his heart rate at 24 or 21. Even if he is a trained agent, it would still decrease due to the biological component. I'm not saying his heart is inefficient at 51 because he's able to perform very intense movements in combat even at this age, but there is a decrease in the efficiency of his heart. That's why it's a lot harder to perform things that may have been easier when he was younger. Then again, he's still very skilled. Then we have heart rate maximum. Very similar to maximum of oxygen consumption. This refers to the maximum of heart rate. So this is the maximum heart rate that a person is able to achieve with any form of exercise. Usually we use our HR max to calculate the maximum amount of heart rate that a patient should achieve while performing an exercise. So it's calculated through 220 minus the patient's age. So for example, if Leon is 51, if we subtract that from 220, we would get 169 as his maximum heart rate. So if he's able to perform high intense workouts, which I assume he would be able to, then he'd be able to achieve that amount of heart rate during that exercise. However, with HR max, as with HRS, it also decreases with age. So it reduces 1 beat per year starting at the age of 10 to 15 years old. Okay, moving on, we have stroke volume. So stroke volume, this is the volume of blood pumped per contraction. So your heart relaxes and contracts every cycle. During its contraction, there is amount of blood that is pumped throughout the many areas of our body to supply it. So that's what we refer to as the stroke volume. It is usually around 60 to 80, but it can reach up to 90 if the efficiency of the heart increases. Let's move to the physiological aspect of heart rate. So we have three concepts here. First, anticipatory response. Even before the actual workout, the heart rate increases to preempt the activity. So catecholamines such as norepinephrine and epinephrine are released while the vagal tone is decreased. Then we have steady state heart rate. So this just refers to the optimal amount of HR that responds to a form of exercise and the circulatory demands. So this is what we target and the optimum amount basically. An efficient heart usually observed with lower heart rates. So for example, athletes, they have a lower heart rate than people who are untrained. A lower heart rate indicates a faster recovery period and was more efficient. So if you think about it, if a person has a lower amount of heart rate and they are training, that would indicate that for each contraction that their heart performs, the amount of blood that they pump out, the stroke volume, would be larger than that of the untrained individual who has a higher heart rate. Basically, the higher your heart rate is, that means there is less quality in the amount of blood being pumped out of the heart with each contraction. So that's why a lower heart rate is generally a indication that a person has an efficient and a healthy heart. So we've discussed heart rate and we've discussed oxygen consumption. Now let's go to their relationship. How did they relate to one another? So here we have a graph, heart rate in the y-axis, oxygen consumption in the x-axis. Usually heart rate increases with exercise intensity, and it is very similar to what I described with oxygen consumption. In the first 3 to 6 minutes, it increases during the exercise, first 3 to 6 minutes here. However, again, we have the HR max. It is limited by our biological and physiological component. So whatever your HR max is, that is the limit until when the heart rate can increase. Okay, so we've discussed these two aspects with responses of the systemic. Now let's go to the stroke volume. We want to discuss a specific concepts because this is a very important aspect. Again, as I mentioned earlier, stroke volume refers to the amount of blood pumped out by the heart with each contraction. It is usually around 60 to 80, but it can reach up to 90 if the heart is efficient. Let's go to the factors that affect stroke volume. We have 3. Volume of venous blood return. Secondly, ventricular distensibility and contractility. And thirdly, aortic or pulmonary artery pressure. I like to remember this with the mnemonic. Bullets can deliver pain, blood, contractility, distensibility, and pressure. So let's go over each of them one by one. So what does this mean by the amount of venous return? Essentially, since the stroke volume refers to the amount of blood being pumped out of the body by the heart, it would mean that if you have a higher preload, a higher venous return, a higher amount of blood that returns to the heart, then of course you would have a higher amount of blood that would be pumped out of the heart, which is very, very good. So for example here, if Leon Kennedy is in a mission and he gets shot in the heart, or at least his heart is damaged by any weapon, this would mean the amount of blood that goes into his heart is decreased because it's seeping into his other organs. It's not contained within the chamber of the heart. That would mean the venous blood, the venous return to his heart would be decreased. So if you think about it, if stroke volume refers to the amount of blood being pumped out, if we have a decrease in the amount of blood within the heart, then we would also have a decrease in the amount of blood we can pump out, right? Hopefully that makes sense. Next, we have ventricular distensibility and contractility. This basically just refers to how strong can your heart pump. I will be discussing this furthermore later with the Frank-Starling law. Lastly, you have aortic or pulmonary artery pressure. So of course, if the heart, if for example a patient with hypertension, usually their arteries are stiff, and it would take a higher amount of force for their ventricle to pump out blood. Sometimes it's not even enough because the stiffness of the arteries are too much. So they would be able to only pump out only a little amount of blood, which is not really that great. That's why hypertension can be a big problem in patients. Especially, you have to watch out if you're going to perform exercises for patients with hypertension. We will be discussing that more later. So, again, bullets can deliver pain, venous blood return, ventricular contractility and distensibility, and aortic or pulmonary artery pressure. Bullets can deliver pain. We have Leon Kennedy with his gun here. Moving on. We've discussed oxygen consumption, heart rate, and stroke volume. Now let's discuss the relationship between stroke volume and oxygen consumption. So oxygen consumption refers to the amount of oxygen you consume with an exercise. Stroke volume is the amount of blood that is pumped out by the heart during each contraction. Usually, it increases if exercise increases. If you're performing a higher intensity of an exercise, your stroke volume would definitely increase to pump out more blood in the respective organs that require that amount of circulatory demand. However, it only increases up to 40 to 60% maximum. It's not able to reach 100%. It plateaus. But why? Why does that happen? So the limiting factor that causes stroke volume to plateau, despite an increased exercise intensity, is look at the picture here. What do you think is the focus in these pictures? Yeah, we're just gonna pretend that there's a head there. It's the heart. See? Mother Miranda is holding a heart in her hand, which she took out of Ethan. So the heart, each person has a designated chamber size, right? So the stroke volume can only increase so much because it is limited by the chamber size of the heart. Thank you, Mother Miranda, for that example. Now we go on to